Hello everyone, I'm Pharmacist Michael, and today I'm going to talk about one of the lesser known eating disorders. This is known as night eating syndrome. And the reason I'm doing this is because I think there might be some of you out there who might have this and not even know it. So what is night eating syndrome? This is where the people who suffer from this can't sleep unless they get up and eat something. And this usually ends up happening several times a night. They actually think in their mind that they have to eat to be able to go to sleep. The problem is, even though they eat something, they may relax for a little bit, but they end up having to get up multiple times a night, just like I said. We know that about 1 in 100 people in the United States actually have night eating syndrome. And the symptoms are, just like I say, waking up at night to eat, eating more than 25% of your calories at night is a good indication that you have this disorder. Decreased appetite during the day. When you wake up, you probably won't be hungry because you've been eating throughout the night, right? And we also find a lot of comorbidity with depression and anxiety. We think it's caused by a circadian rhythm disorder, and we know that it runs in families, so there is definitely a genetic predisposition to this disorder. We also know that these patients often have substance use disorders. We already talked about depression and anxiety. And they may diet during the day, which makes them super hungry at night. They may not be taking in enough calories during the day. How do we treat this? Well, just like anxiety and depression, we're going to start with cognitive behavioral therapy. So group therapy is a good starting point. The way I actually learned about this is I was going to do a video on Zoloft or sertraline, which is an SSRI, and I found out that that drug is actually approved for this condition. So that video will be coming out probably in the next couple of days, but SSRIs are one of the first drugs that we use for this. We also want to make sure you're getting enough sleep. Try to practice sleep hygiene. Now, I know that sounds hard to do when you're constantly waking up because you feel like you have to eat. And I think there's some compulsivity there too, but try to make sure you practice all of the sleep hygiene steps. Go to bed at the same time every night. Make sure your room is quiet. Comfortable clothing, comfortable temperature. Make sure it's dark in your room. Only use your bed for sex and sleep. Don't read or watch an iPad or your phone in bed. All of these things can help you sleep better. Also, make sure you're staying active during the day. You want to make sure you tire your body out so you're more apt to sleep. And pay attention to your mental health. Meditation, guided imagery, deep breathing exercises, all of these things, prayer, can help you avoid symptoms such as those in nighttime eating syndrome. If you think you may have this, I suggest checking with your physician. You might be able to get by just by changing your routines, maybe eating a little bit more during the day, maybe eating more smaller meals, making sure you're not hungry at night. You may need an antidepressant. That your anxiety may be high enough to where it's predisposing you towards this. So if you think you have nighttime eating syndrome, see your doctor. If you want to talk to me about it, feel free to email me, michael.brown@sunshinentc.com. I'd be happy to talk to you. We can go through some ways that you might be able to rid yourself of this. But I don't have to tell you it's not healthy to eat a quarter of your calories in the middle of the night unless you're working night shift, right? So I hope you've learned something from this. I know I have. And if you know someone who might have this disorder or someone who might just be interested in this video, please forward this on to them. Please subscribe to my channel for more happy and healthy videos. I'm Pharmacist Michael. Be happy and be healthy.